physiologist for the SIS program, and in this series of videos we're going to be discussing different chronic health conditions, their risks, the different types of exercise that can help in the management of these conditions, and the mechanisms behind how exercise impacts each of these conditions. In this video, we'll be discussing osteoarthritis, osteoporosis, and musculoskeletal injuries. Osteoarthritis is characterised by the degeneration of the articular cartilage in the joints. The cartilage in our joints covers the ends of the bone and allows for cushioning during movement and also helps to aid in smooth movement. Over time, however, with wear and tear and as part of the ageing process, the cartilage can begin to degenerate in certain areas, which can result in joint pain and reduced joint movement. Osteoporosis is a condition of low bone mineral density and can result in weaker and more porous bones. The weakening of the bone structure can result in an increased risk of fractures and falls due to the bones being more brittle and not as forgiving to impact as they used to be. Musculoskeletal injuries cover a wide range of different conditions that impact the muscles, the skeleton, and the different structures in the body that help to aid in movement. This can result in things such as chronic low back pain, shoulder impingement, or rotator cuff injuries, bursitis, bulging spinal discs, and many more different injuries that can impact our body's ability to move and function. There are a number of different factors that can increase the risk of developing one of these conditions. Arthritis, osteoporosis, and musculoskeletal injuries all share common risk factors, including being over the age of 50, having a long-standing history of inactivity, being overweight, or having a previous bone, muscle, or joint injury. For osteoporosis, women who are post-menopause or over the age of 50 are at an increased risk due to the hormone estrogen playing such a large role in our bone's mineral density. As the levels of estrogen begin to decrease after menopause, the likelihood of developing osteoporosis increases, as does the likelihood of having a fracture due to a fall. In terms of exercises that are important for osteoarthritis and musculoskeletal injuries, exercises that emphasise stretching and strengthening of the muscles here are key. Strengthening and stretching of the muscles around the joints or injured tissue can enhance the joint stability and mobility whilst allowing you to still move within the limitations of your body. A combination of resistance training with bands, weights, or machine weights, as well as targeted stretching, can alleviate stress on the joint and the injury and allow you to move more efficiently while still supporting the affected area. Exercises that place stress on the bones are the ones that are the most important for osteoporosis. Impact and weight-bearing exercises, such as walking, running, jogging, skipping, or leaping, are the exercises that can place a controlled level of stress on your bones to incite the rebuilding and strengthening process without being at risk of a fracture to increase your bone mineral density. Exercise improves musculoskeletal injuries by strengthening and stretching the tissues around the joint to allow you to better support the injured area. The stronger that your muscles are, the more efficient your body is able to move, which allows for a decreased stress to be placed on the injured tissue to allow for a more efficient healing process. Stronger and more flexible muscles allow for a more even weight distribution across the whole joint. The more stable your joints are, the more evenly this load can be distributed across the whole joint as opposed to over specific problem areas to help in reduction in joint pain. The more we are able to decrease joint pain, the greater the level of mobility and function that is possible at that joint. Exercises can also slow the rate of degeneration of the cartilage, allowing us to slow the arthritis process and to reduce further wear and tear in the joint. An overall reduction in the joint pain can help to increase independence and to allow you to return to activities that you were once not able to complete. The more we are able to decrease joint pain, the greater your level of mobility and function will be possible at that joint. Exercise can also slow the rate of degeneration of the cartilage in the joints, allowing us to slow the arthritic process and reduce further wear and tear of the joint. An overall reduction in joint pain can increase independence to allow you to return to activities you had otherwise been avoiding and to allow you to better manage other health conditions and tasks in day-to-day life. Weight-bearing exercise helps to improve bone mineral density for osteoporosis through increasing the amount of stress placed on the bones. As we apply a controlled level of stress across the bones are able to better repair themselves, which leads to an increase in our bone mineral density. This increase in density then reduces the risk of fractures in the future by better allowing your bones to deal with stress. In combination with different lifestyle factors, such as an increase in calcium and vitamin D intake, over time, the strength of our bones can increase and also slow the rate of degeneration. If you would like more information on the benefits of exercise for these conditions, you can visit the Better Health Vic website, Arthritis Australia, Exercise Right Australia, or we can find a time to discuss how exercise would work for you and this condition.